Question 1. An HHA is assisting a client with early-stage dementia. The client usually enjoys their morning cereal but today pushes it away, mumbles, and frequently rubs their head. What is the most appropriate immediate action for the HHA? A. Insist the client eat a few bites, as routine is important. B. Report the client's behavior to the supervisor at the end of the shift. C. Document the refusal of food and observe for further changes. D. Promptly check the client's vital signs and report the observations to the supervisor. Answer: D. Promptly check the client's vital signs and report the observations to the supervisor. This question tests your ability to observe and report a change in a client's condition, especially when they cannot clearly communicate their discomfort. The key clues are the client's unusual refusal of food, mumbling, and rubbing their head, which are significant deviations from their normal behavior and could indicate pain, illness, or a neurological change. The most appropriate immediate action is to gather more objective data by checking vital signs and then promptly report all observations to the supervisor, as this ensures timely intervention for a potentially acute issue. For instance, a new headache might be causing the distress, requiring medical assessment. Always remember, when you notice an unusual change, it's crucial to act swiftly by gathering more information and communicating with your supervisor. Question 2. A client receiving hospice care expresses a desire to just be left alone and refuses personal care for the day, which is unusual for them. What is the HHA's most ethical response? A. Gently persuade the client that personal hygiene is important for comfort. B. Report the client's refusal to the nursing supervisor and respect their wish for the day, offering comfort care if accepted. C. Complete only essential care, like mouth care, and document the refusal for other tasks. D. Disregard the request, as HHAs are obligated to provide all scheduled care. Answer: B. Report the client's refusal to the nursing supervisor and respect their wish for the day, offering comfort care if accepted. This question assesses your understanding of client rights and ethical care, particularly in hospice settings. The keyword most ethical emphasizes respecting the client's autonomy, even if it means declining care, especially as comfort is paramount in hospice. While personal hygiene is important, a client's expressed wish to be left alone, especially when unusual, requires respectful acknowledgement. The correct action is to report the refusal to the supervisor to ensure the care plan can be adjusted and to respect the client's immediate choice, while still offering comfort if possible. For example, if the client states they don't want a bath but accepts a cool cloth on their forehead, that's respecting their choice while still providing care. Your role is to support the client's wishes, even if they differ from the routine, and ensure the care team is aware. Question 3. An HHA is performing range of motion (ROM) exercises for a client. The client suddenly winces and says, "That hurts." What should the HHA do first? A. Stop the exercise immediately and report the pain to the supervisor. B. Continue the exercise gently, explaining that some discomfort is normal for ROM. C. Skip that particular joint and continue with other ROM exercises. D. Reduce the range of motion slightly and continue the exercise, observing the client closely. Answer: A. Stop the exercise immediately and report the pain to the supervisor. This question tests your immediate response to client pain during care, specifically during range of motion exercises. The keywords "suddenly winces" and "that hurts" are critical indicators of actual pain, not just minor discomfort. When a client expresses pain during any procedure, your primary responsibility is to stop the activity immediately to prevent further injury or discomfort. It is never appropriate to continue an exercise that causes pain or to dismiss a client's verbalized pain. Once the exercise is stopped, reporting the incident and the client's pain to the nursing supervisor is essential so they can assess the situation and adjust the care plan if needed. This ensures the client's safety and comfort above all else. Question 4. While helping a client with diabetes prepare a meal, the HHA notices the client seems confused, is sweating profusely, and complains of feeling shaky. The client's speech is slurred. What is the most immediate action the HHA should take? A. Call emergency services, 911, immediately. B. Offer the client a glass of water and wait for improvement. C. Check the client's blood glucose level if trained and equipment is available, and offer a quick-acting sugar source. D. Contact the client's family to inform them of the situation. Answer: C. Check the client's blood glucose level if trained and equipment is available, and offer a quick-acting sugar source. This question assesses your ability to recognize and respond to symptoms of hypoglycemia, low blood sugar, which is a medical emergency for a client with diabetes. The keywords confused, sweating profusely, shaky, and slurred speech are classic signs of critically low blood sugar, which requires immediate intervention. If trained and if the client's care plan allows, checking their blood glucose helps confirm the suspicion. The most immediate and life-saving action is to offer a quick-acting sugar source, such as juice, regular soda, or glucose tablets, to raise their blood sugar quickly. You must also report the incident to your supervisor, but addressing the immediate medical need comes first. Question 5. An HHA is preparing to assist a client who has recently had a stroke and has left-sided weakness with transferring from the bed to a wheelchair. Where should the wheelchair be positioned? A. On the client's left side, facing the head of the bed. B. On the client's right, stronger, side, angled towards the bed. C. At the foot of the bed, directly in front of the client. D. On the client's left side, facing the foot of the bed. Answer: B. On the client's right, stronger, side, angled towards the bed. This question tests your knowledge of safe transfer techniques for clients with unilateral weakness, a common issue after a stroke. The key is understanding that clients should always be encouraged to bear weight on their stronger side, and the transfer should pivot towards that side. By positioning the wheelchair on the client's right, stronger, side, it allows the client to use their stronger leg to pivot, reducing the risk of falls and injury for both the client and the HHA. This setup provides maximum support and leverage, making the transfer safer and more efficient. Always remember to allow the client to lead with their stronger side during transfers when weakness is present. Question 6. A client has a Do Not Resuscitate (DNR) order in their care plan. The HHA finds the client unresponsive and not breathing. What is the correct action for the HHA to take? A. Immediately begin CPR and call 911. B. Call 911 and then check the client's pulse. C. Position the client comfortably, notify the supervisor, and do not perform CPR. D. Attempt to wake the client by shaking them and shouting. Answer: C. Position the client comfortably, notify the supervisor, and do not perform CPR. This question addresses a critical ethical and legal directive, respecting a client's Do Not Resuscitate (DNR) order. The keyword DNR explicitly means that if the client's heart or breathing stops, resuscitation efforts like CPR should not be performed. Your primary role becomes providing comfort and dignity. The correct action is to ensure the client is in a comfortable position, then immediately notify your supervisor and the client's family as per policy, but under no circumstances should you initiate CPR or other resuscitative measures. This honors the client's wishes and legal directive. Question 7. An HHA is caring for a client with a urinary catheter. The HHA notices the urine in the drainage bag is cloudy and has a strong, foul odor. The client also complains of mild abdominal discomfort. What should the HHA do? A. Empty the drainage bag and encourage the client to drink more fluids. B. Note the observations and report them to the nursing supervisor as soon as possible. C. Attempt to flush the catheter with sterile water to clear any blockages. D. Replace the catheter and drainage bag with new, sterile ones. Answer: B. Note the observations and report them to the nursing supervisor as soon as possible. This question tests your ability to identify and report signs of a potential urinary tract infection, UTI, in a client with a catheter. The keywords cloudy, strong, foul odor of urine, and mild abdominal discomfort are all classic indicators that an infection may be developing. HHAs do not assess, diagnose, or treat medical conditions like UTIs. Their role is to observe and report changes. The correct action is to document these important observations and immediately communicate them to the nursing supervisor, who can then determine the appropriate medical intervention. Always remember, when you spot changes suggesting an infection, reporting it quickly is key to getting the client the right medical attention. Question 8. A client with osteoporosis is at high risk for falls. When assisting this client to ambulate, what is the most important safety measure for the HHA to take? A. Encourage the client to wear slippers for comfort. B. Ensure the client uses a walker even for short distances. C. Keep the client's environment brightly lit at all times. D. Use a gait belt during transfers and ambulation, and walk slightly behind and to the side. Answer: D. Use a gait belt during transfers and ambulation, and walk slightly behind and to the side. This question focuses on fall prevention for a client with osteoporosis, a condition that makes bones brittle and prone to fractures. The keyword most important safety measure emphasizes active physical support. While other options might offer some benefit, using a gait belt correctly provides a secure grasp point for the HHA to prevent falls or support the client if they lose balance, directly addressing the risk. Walking slightly behind and to the side allows the HHA to intervene quickly without hindering the client's movement. For example, if the client stumbles, the HHA can quickly stabilize them using the gait belt. Always prioritize direct physical support and stabilization when assisting clients at high fall risk. Question 9. The HHA observes a client's wound dressing is completely saturated with fluid and starting to leak. What is the appropriate action? A. Remove the old dressing, clean the wound, and apply a new sterile dressing. B. Place a clean, dry dressing directly over the saturated one to absorb the excess. C. Notify the nursing supervisor immediately and follow their instructions. D. Document the observation in the client's chart and wait for the next scheduled dressing change. Answer: C. Notify the nursing supervisor immediately and follow their instructions. This question assesses your role in wound care, specifically when a dressing is compromised. The keywords completely saturated with fluid and starting to leak indicate a significant issue that an HHA is not typically authorized to manage independently. HHAs generally do not perform wound care that involves removing and applying sterile dressings unless specifically trained and delegated by a nurse. The appropriate action is to promptly inform the nursing supervisor about the saturated dressing, as this could indicate increased drainage, a potential infection, or simply the need for a dressing change beyond the HHA's scope. The supervisor will then provide specific instructions or send a nurse to reassess the wound. Question 10. A client with expressive aphasia struggles to communicate their needs. The HHA wants to understand if the client is comfortable. What is the best communication strategy? A. Ask complex questions with multiple choices. B. Assume the client is comfortable if they are quiet. C. Use simple, direct questions that can be answered with a nod or shake of the head, or point to pictures. D. Speak loudly and slowly to ensure the client hears you. Answer: C. Use simple, direct questions that can be answered with a nod or shake of the head, or point to pictures. This question focuses on effective communication with a client experiencing expressive aphasia, a condition affecting the ability to speak or write. The key challenge is that the client knows what they want to say but struggles to get the words out. Asking simple, direct questions that require only a yes or no response, like a nod or head shake, or using visual aids such as pictures, helps them express themselves without the frustration of finding words. Speaking loudly, D, is unnecessary unless there is also a hearing impairment. For example, instead of asking, "Are you comfortable with the temperature of the water for your bath, or would you prefer it warmer or cooler?" ask, "Is the water warm enough?" and wait for a nod or shake. Always simplify communication and provide alternative ways for clients to respond. Question 11. An HHA is assisting a client who recently had hip replacement surgery. The care plan states to avoid hip flexion beyond 90 degrees and internal rotation. During dressing, which action by the HHA would be incorrect and potentially harmful? A. Helping the client put on shoes and socks by reaching down to their feet. B. Assisting the client to pivot on their unaffected leg when transferring. C. Using an assistive device to help the client pick up items from the floor. D. Ensuring the client keeps a pillow between their knees while lying on their side. Answer: A. Helping the client put on shoes and socks by reaching down to their feet. This question tests your knowledge of post-hip replacement precautions. The keywords hip flexion beyond 90 degrees and internal rotation are crucial instructions to prevent dislocation of the new hip. Reaching down to the feet to put on shoes and socks forces the hip to bend more than 90 degrees and often causes internal rotation, which is precisely what needs to be avoided. Instead, the client should use assistive devices like a long-handled shoehorn or sock aid. All other options are either correct practices or safe. Understanding these movement restrictions is vital to protect the new hip joint. Question 12. A client insists on keeping their house excessively warm, even though the HHA feels it's dangerously hot. The client has no cognitive impairment. What should the HHA do? A. Turn down the thermostat slightly when the client is not looking. B. Explain the risks of overheating and offer alternatives like lighter clothing, then document the client's choice and report to the supervisor. C. Insist that the client allow the temperature to be lowered for safety reasons. D. Document the client's preference but do nothing further, as it's their choice. Answer: B. Explain the risks of overheating and offer alternatives like lighter clothing, then document the client's choice and report to the supervisor. This question addresses client autonomy versus safety, particularly when the client is cognitively intact. While safety is paramount, you must respect a client's choices if they are of sound mind. The keyword "no cognitive impairment" is vital here. It means the client can make informed decisions. The correct approach is to educate the client about the potential risks of their preference and offer safe alternatives. After doing so, you must respect their decision, document it thoroughly, and report it to your supervisor, who may need to discuss it further with the client or family. This balances client rights with your responsibility to report potential hazards. Question 13. An HHA is assisting a client who requires assistance with feeding due to swallowing difficulties, dysphagia. Which action is most important to prevent aspiration? A. Encourage the client to talk during meals to promote socialization. B. Provide liquids through a straw to make swallowing easier. C. Ensure the client is in an upright position and encourage small bites, slow eating, and checks for pocketing food. D. Offer a variety of foods, including thin liquids, to keep the client hydrated. Answer: C. Ensure the client is in an upright position and encourage small bites, slow eating, and checks for pocketing food. This question focuses on preventing aspiration, which is when food or liquid accidentally enters the lungs instead of the stomach, a serious risk for clients with dysphagia, swallowing difficulties. The keywords swallowing difficulties and prevent aspiration highlight the need for careful feeding techniques. Keeping the client in an upright position during and after meals, encouraging small bites, a slow pace, and checking inside their mouth for pocketed food, food hidden in the cheeks, are all crucial to ensure food is swallowed safely. Using straws, B, can sometimes increase aspiration risk for those with dysphagia, and thin liquids, D, are often restricted unless thickened. Always prioritize safe swallowing practices to protect the client's airway. Question 14. An HHA notices a new, reddish, non-blanchable, does not turn white when pressed, area on a client's sacrum. What does this observation most likely indicate? A. A temporary skin irritation that will resolve on its own. B. An allergic reaction to a new soap or lotion. C. The beginning of a pressure injury, bed sore. D. A superficial bruise from recent activity. Answer, C. The beginning of a pressure injury, bed sore. This question tests your ability to identify early signs of a pressure injury, also known as a bed sore or decubitus ulcer. The keywords new, reddish, and non-blanchable on the sacrum, a common pressure point, are classic indicators of a stage 1 pressure injury. Non-blanchable means the redness persists even when you gently press on it, which signals damage to the underlying tissues. This is not a temporary irritation or bruise. Recognizing these signs early is crucial because pressure injuries can quickly worsen, leading to serious health complications. Always report any new skin changes, especially non-blanchable redness, to your supervisor immediately. Question 15. The HHA is assisting a client with personal hygiene. The client suddenly becomes agitated and begins to hit the HHA's arm. What is the most appropriate initial response? A. Restrain the client immediately to prevent further harm. B. Yell at the client to stop the behavior. C. Step back, ensure your own safety, try to de-escalate with a calm voice, and then report the incident. D. Continue with care, assuming the client doesn't know what they are doing. Answer, C. Step back, ensure your own safety, try to de-escalate with a calm voice, and then report the incident. This question addresses how to respond to client aggression, a challenging but important aspect of HHA care. The keywords agitated and begins to hit signify a need for immediate safety precautions and de-escalation. Your own safety is always the top priority. Stepping back protects you, and then trying to calmly de-escalate the situation can help reduce the client's agitation without worsening it. Restraining or yelling, A, B, can escalate the situation and is usually inappropriate. Continuing care, D, is unsafe. After ensuring safety and attempting de-escalation, it is crucial to report the incident to your supervisor, as this behavior may indicate an underlying issue or a need for a revised care plan. Question 16. A client with severe arthritis struggles to grasp and hold utensils during mealtime. What is the most helpful adaptation the HHA can suggest or provide to promote independence? A. Offer only pureed foods that don't require utensils. B. Encourage the client to eat with their fingers to avoid utensils. C. Provide utensils with enlarged or built-up handles. D. Feed the client completely to save time and effort. Answer, C. Provide utensils with enlarged or built-up handles. This question focuses on promoting client independence and adapting to physical limitations, specifically for someone with severe arthritis affecting hand dexterity. The keyword most helpful adaptation points to a solution that empowers the client. Utensils with enlarged or built-up handles are designed to be easier to grasp and hold for individuals with limited hand strength or dexterity. This simple modification allows the client to feed themselves more independently, maintaining dignity and control, rather than relying on pureed food or being completely fed. This type of assistive device is a practical way to support continued independence. Question 17. The HHA is asked by a client's family member to share details about another client's condition, as they are old friends. What is the HHA's appropriate response? A. Politely explain that client information is confidential and cannot be shared. B. Share a few general, non-identifying details to be polite. C. Tell the family member that they need to ask the client directly. D. Suggest they ask the supervisor for the information. Answer: A. Politely explain that client information is confidential and cannot be shared. This question tests your understanding of client confidentiality, a fundamental principle of healthcare ethics and a legal requirement under HIPAA. The keywords "share details about another client" highlight a breach of privacy. Regardless of any personal connection, an HHA is legally and ethically bound to protect all client information. The appropriate response is to politely but firmly state that you cannot share any information about other clients, as it is confidential. This upholds the client's right to privacy and maintains professional boundaries. Question 18. An HHA observes a client's medication bottle on the counter. The client asks the HHA to remind them when to take their next dose and to get the bottle for them. What is the most appropriate action for the HHA? A. Pour the correct dose into a cup and give it to the client. B. Hand the client the medication bottle and verbally remind them of the time. C. Inform the client that HHAs cannot administer or prepare medications, but can remind them when to take it if it's already prepared by the client or nurse. D. Tell the client to wait for the nurse to arrive to get their medication. Answer: C. Inform the client that HHAs cannot administer or prepare medications, but can remind them when to take it if it's already prepared by the client or nurse. This question clarifies the strict boundaries of medication assistance for HHAs. The critical concept is that HHAs are never permitted to administer or prepare medications, which includes pouring pills from a bottle. Your role is generally limited to prompting or reminding a client to take medications that are already set up and prepared by a nurse or the client themselves. Therefore, the most appropriate action is to politely explain your scope of practice, and if the medication is already prepared in a dosette or by the client, then a reminder is acceptable. For example, you can say, "Your nurse set up your pill box for 2 p.m., it's almost time for your medication." Question 19. A client has been refusing food and fluids for 2 days and appears weak and disoriented. The family insists on force-feeding them to keep them strong. What should the HHA do? A. Follow the family's instructions, as they know the client best. B. Gently explain to the family the risks of force-feeding and immediately report the situation to the nursing supervisor. C. Attempt to coax the client to eat small amounts of their favorite foods. D. Document the refusal but do not engage with the family's request. Answer: B. Gently explain to the family the risks of force-feeding and immediately report the situation to the nursing supervisor. This question presents a serious ethical and safety dilemma involving client autonomy, family wishes, and the HHA's scope of practice. The keywords "refusing food and fluids" and "weak and disoriented" indicate potential medical issues, while force-feeding is a dangerous and unethical practice. Force-feeding can lead to aspiration, discomfort, and a violation of the client's rights. The HHA's role is not to mediate family disputes or perform medical interventions, but to protect the client and report concerns. Explaining the risks and immediately reporting to the supervisor ensures the client's safety and allows the care team to address the family's concerns appropriately. Question 20. When assisting a client with bathing, the HHA notices an open lesion with drainage between the client's toes. What is the priority action? A. Clean the lesion thoroughly with soap and water and apply a bandage. B. Note the observation in the client's chart to be reviewed later. C. Immediately report the finding to the nursing supervisor. D. Advise the client to keep the area dry and uncovered. Answer: C. Immediately report the finding to the nursing supervisor. This question tests your ability to recognize and prioritize reporting a significant skin integrity issue. The keywords open lesion with drainage clearly indicate a potential wound or infection, which is a critical observation. HHAs are not permitted to treat open wounds, apply bandages beyond basic dressing changes as specifically delegated, or diagnose conditions. Your most important and immediate responsibility is to report this finding to the nursing supervisor. This ensures that a nurse can promptly assess the lesion and determine the appropriate medical intervention. Neglecting to report or attempting to treat it yourself could lead to worsening of the condition. Question 21. An HHA is caring for a client who is terminally ill and regularly expresses feelings of hopelessness, stating, "I just want it all to end." What is the most appropriate response from the HHA? A. Tell the client that things will get better and to stay positive. B. Distract the client by changing the subject to a more cheerful topic. C. Listen empathetically, acknowledge their feelings, and report the statements to the nursing supervisor. D. Advise the client to focus on their family and loved ones. Answer: C. Listen empathetically, acknowledge their feelings, and report the statements to the nursing supervisor. This question addresses providing emotional support to a terminally ill client while adhering to professional boundaries and safety protocols. The keywords terminally ill and feelings of hopelessness, especially "I just want it all to end," are serious indicators of emotional distress and potential thoughts of self-harm. It is crucial to offer empathetic listening, which means acknowledging their feelings without judgment or trying to fix them. However, as an HHA, you are not a mental health professional. Therefore, the most appropriate and responsible action is to immediately report these statements to your nursing supervisor, who can ensure the client receives proper psychological or spiritual support. Question 22. Which of the following is the best example of using proper body mechanics when assisting a client to stand from a chair? A. Bending at your waist to grasp the client's arms. B. Keeping your feet close together for a narrow base of support. C. Squatting down, keeping your back straight, and using your leg muscles to lift. D. Twisting your torso to pull the client upward. Answer: C. Squatting down, keeping your back straight, and using your leg muscles to lift. This question tests your understanding and application of proper body mechanics, which is essential for preventing injuries to both the HHA and the client during transfers and lifts. The keywords proper body mechanics refer to using your body in the safest and most efficient way. Squatting down, keeping your back straight, and using the strong muscles in your legs to lift are the core principles. This technique places the strain on your legs, which are designed for heavy lifting, rather than on your back, which is vulnerable to injury. Bending at the waist, having a narrow base of support, or twisting your torso are all incorrect and dangerous practices. Always remember to lift with your legs, not your back. Question 23. An HHA is assigned to a client from a different cultural background who refuses a shower but readily accepts a sponge bath, which is not typical for the client's usual routine. What is the best response? A. Insist on a shower, explaining it's part of the care plan. B. Document the refusal of a shower and proceed with the sponge bath, noting the client's preference and cultural background. C. Report the client's non-compliance to the supervisor. D. Ask the client's family to convince them to take a shower. Answer: B. Document the refusal of a shower and proceed with the sponge bath, noting the client's preference and cultural background. This question highlights the importance of cultural sensitivity and respecting client preferences in care. The keywords different cultural background and refuses a shower but readily accepts a sponge bath suggest that the client's preference might be rooted in their cultural norms or personal comfort, even if it deviates from the typical care plan. The best approach is to respect the client's choice while still ensuring their hygiene needs are met with the accepted alternative. Documenting this preference and the cultural context is crucial for clear communication within the care team, allowing them to adjust the care plan if appropriate. Question 24. A client expresses to the HHA that they are feeling very lonely and isolated since their spouse passed away. What is the most appropriate way for the HHA to respond? A. Change the subject to something more positive to cheer them up. B. Tell them that everyone feels lonely sometimes and it will pass. C. Listen empathetically, acknowledge their feelings, and encourage them to talk more, while also reporting these feelings to the supervisor. D. Advise them to join a social club or find a new hobby. Answer: C. Listen empathetically, acknowledge their feelings, and encourage them to talk more, while also reporting these feelings to the supervisor. This question addresses providing emotional support while maintaining professional boundaries when a client expresses feelings of loneliness. The keywords feeling very lonely and isolated indicate emotional distress that needs a compassionate response. Empathetic listening and acknowledging their feelings, it sounds like you're really missing your spouse, validate their experience. While encouraging them to talk more helps, it's also crucial for an HHA to report these expressions to the nursing supervisor. This ensures that the client's emotional well-being is part of the overall care plan and that they can receive appropriate professional support if needed, which is outside the HHA's scope of practice. Question 25. The HHA observes that a client who uses a walker is consistently leaning heavily to one side and dragging their foot. The client states, "I'm just tired." What is the best course of action? A. Encourage the client to rest more frequently. B. Adjust the walker height to compensate for the lean. C. Document the observation and immediately report it to the nursing supervisor. D. Suggest the client try to walk without the walker to strengthen their muscles. Answer: C. Document the observation and immediately report it to the nursing supervisor. This question focuses on recognizing and reporting significant changes in a client's mobility, even if the client attributes it to fatigue. The keywords consistently leaning heavily to one side and dragging their foot are concerning deviations from normal ambulation and could indicate a worsening condition, a new medical issue, like a stroke, fall risk, or muscle weakness, or an improperly fitted walker. As an HHA, your role is to observe and report these changes, not to diagnose or adjust equipment without instruction. Documenting and promptly reporting allows the nursing supervisor to assess the situation and intervene appropriately, ensuring the client's safety. Question 26. When assisting a client with limited mobility to dress, which approach best promotes independence and conserves the client's energy? A. Dress the weaker side first, undress the stronger side first. B. Dress the stronger side first, undress the weaker side first. C. Allow the client to choose their outfit only after they are fully dressed. D. Complete all dressing tasks quickly to minimize the client's effort. Answer: A. Dress the weaker side first, undress the stronger side first. This question tests your knowledge of the correct technique for dressing a client with limited mobility, particularly when one side is weaker. The technique, dress the weaker side first, undress the stronger side first, is crucial for promoting independence and conserving the client's energy. By dressing the weaker side first, you can guide the limb into the clothing more easily, allowing the stronger side to assist. When undressing, starting with the stronger side allows it to move freely and manage the garment more easily, making the process smoother and less strenuous for the client. This method makes dressing and undressing more manageable for both the client and the HHA. Question 27. An HHA arrives at a client's home and finds the client slumped over in their chair, unresponsive, and not breathing. What is the first action the HHA should take, assuming no DNR order is present? A. Call the client's family immediately. B. Begin CPR compressions. C. Check for a pulse and breathing. D. Call 911 or local emergency number. Answer: D. Call 911 or local emergency number. This question describes a critical medical emergency requiring immediate and decisive action. The keywords slumped over, unresponsive, and not breathing indicate a life-threatening situation. While checking for a pulse and breathing, C, is part of the assessment, the absolute first step in an observed cardiac or respiratory arrest in a home setting is to activate the emergency medical system by calling 911 or your local emergency number. This ensures professional help is on its way. Once 911 is called, you would then follow their instructions, which often include beginning CPR if you are trained and it is appropriate. Never delay calling for emergency assistance in such a severe situation. Question 28. A client has a history of congestive heart failure, CHF. The HHA notices the client's ankles are significantly more swollen than usual, and the client reports feeling short of breath, even at rest. What should the HHA do? A. Elevate the client's legs and encourage them to rest. B. Document the observations and notify the nursing supervisor immediately. C. Restrict the client's fluid intake for the remainder of the day. D. Offer the client a diuretic medication if available. Answer: B. Document the observations and notify the nursing supervisor immediately. This question addresses recognizing and reporting signs of worsening congestive heart failure, CHF, a serious condition. The keywords significantly more swollen than usual ankles and short of breath, even at rest, are critical indicators that the client's CHF may be worsening, potentially leading to fluid accumulation in the lungs. These are acute changes requiring prompt medical evaluation. As an HHA, you do not diagnose or treat medical conditions, nor do you adjust fluid intake or administer medication. Your vital role is to accurately document these observations and immediately report them to the nursing supervisor so they can arrange for a timely medical assessment and intervention. Question 29. An HHA is caring for a client with early Alzheimer's disease. The client becomes distressed, repeatedly asking where their deceased spouse is and accusing the HHA of hiding them. What is the most effective way to respond? A. Remind the client firmly that their spouse has passed away. B. Distract the client by changing the subject to a favorite activity or object. C. Join in the client's reality by saying, "I haven't seen them, but let's look together," then gently redirect. D. Explain logically that the spouse is no longer alive and try to calm them. Answer: B. Distract the client by changing the subject to a favorite activity or object. This question addresses the appropriate response to a client with Alzheimer's disease who is experiencing confusion or delusion, a common challenge in dementia care. The keywords distressed, repeatedly asking, and accusing indicate a need for a therapeutic approach rather than a logical one. For clients with dementia, reality orientation often increases agitation and distress. The most effective approach is often distraction and redirection, which helps shift their focus away from the distressing topic without directly confronting their reality. For example, you could say, "Oh, I haven't seen them, but look at this beautiful flower arrangement," or "Let's listen to your favorite music instead." Question 30. During a meal, a client suddenly begins coughing forcefully, clutching their throat, and appears unable to speak. What is the most immediate action for the HHA? A. Offer the client a glass of water to help them swallow. B. Encourage the client to keep coughing, and prepare to perform abdominal thrusts if necessary. C. Call 911 immediately. D. Perform abdominal thrusts, Heimlich maneuver, without delay. Answer: B. Encourage the client to keep coughing, and prepare to perform abdominal thrusts if necessary. This question describes the classic signs of a partial airway obstruction, which requires specific immediate action. The keywords coughing forcefully and clutching their throat while unable to speak indicate a conscious client who is likely choking but may still be able to clear their airway with continued coughing. The first step is to encourage them to keep coughing, as their own cough is the most effective way to dislodge the obstruction. You should be prepared to perform abdominal thrusts, Heimlich maneuver, if their cough becomes ineffective or they become unconscious, but forceful coughing is initially encouraged. Offering water, A, can worsen the obstruction. Question 31. An HHA is assisting a client with diabetes who needs toenail care. The HHA notices the client's toenails are very thick and discolored. What should the HHA do? A. Carefully trim the toenails, as hygiene is important. B. File the nails down gently with an emery board. C. Soak the feet and then attempt to trim the nails. D. Report the condition of the toenails to the nursing supervisor and do not trim them. Answer: D. Report the condition of the toenails to the nursing supervisor and do not trim them. This question tests your understanding of the specific precautions for foot and nail care for clients with diabetes. The keywords client with diabetes and very thick and discolored toenails are critical. Diabetic clients are highly susceptible to foot injuries and infections due to poor circulation and nerve damage, and thick, discolored nails can indicate fungal infection or other issues. HHAs should never cut the toenails of a diabetic client due to the high risk of injury and infection. The correct action is to report these observations to the nursing supervisor, who can then arrange for a podiatrist, foot specialist, or a nurse specifically trained in diabetic foot care to address the issue. Question 32. A client has a Foley catheter and the HHA notices that the tubing is kinked and there has been no urine drainage for 2 hours. The client is restless and complains of bladder pressure. What should the HHA do first? A. Clamp the catheter to prevent further issues. B. Notify the nursing supervisor immediately. C. Attempt to straighten the kink in the tubing. D. Offer the client fluids to encourage urine production. Answer: C. Attempt to straighten the kink in the tubing. This question addresses an immediate problem with a urinary catheter that can cause acute discomfort and potential harm. The keywords tubing is kinked, no urine drainage for 2 hours, and bladder pressure clearly indicate an immediate, correctable issue that is directly causing the client's discomfort. The first and most direct action is to try and straighten the kink in the tubing to allow urine to flow. If straightening the kink doesn't resolve the issue, or if the client's condition worsens, then notifying the nursing supervisor immediately, B, becomes the next crucial step. However, an HHA can and should attempt to correct a visible and obvious kink. Question 33. An HHA is assisting a client with Parkinson's disease who experiences freezing episodes, sudden, temporary inability to move. The client is trying to walk to the bathroom and freezes mid-stride. What is the best intervention? A. Gently push the client from behind to help them restart movement. B. Have the client sit down immediately and wait for the freezing to pass. C. Provide a rhythmic cue, such as counting, marching in place, or a visual target like stepping over your foot. D. Encourage the client to try harder to move forward. Answer C. Provide a rhythmic cue, such as counting, marching in place, or a visual target like stepping over your foot. This question focuses on managing freezing episodes in clients with Parkinson's disease, a common and challenging symptom. The keywords freezing mid-stride indicate a specific motor block. Pushing the client, A, could cause a fall. Asking them to try harder, D, is unhelpful. While sitting down, B, is safe, it doesn't help them overcome the freeze. The most effective interventions are often rhythmic auditory cues, like counting, singing, or a metronome beat, or visual cues, like stepping over a line, an HHA's foot, or a laser pointer dot. These external cues help bypass the internal motor initiation deficit. Always provide supportive and structured cues to help clients regain movement during these episodes. Question 34. A client reports that their pain medication, which they usually take at 9 a.m., is missing from their secured medication box. The HHA did not see the medication being removed. What is the immediate action for the HHA? A. Ask the client if they might have misplaced it or already taken it. B. Search the client's room thoroughly for the missing medication. C. Immediately report the missing medication to the nursing supervisor. D. Document the client's report and wait for the nurse's next visit. Answer C. Immediately report the missing medication to the nursing supervisor. This question addresses the serious issue of missing medication, which could indicate a safety concern, misuse, or even diversion. The keywords pain medication, missing from secured medication box, and HHA did not see it removed highlight the gravity of the situation. As an HHA, you are not responsible for investigating missing medication or diagnosing the cause. Your immediate and most important responsibility is to report this critical observation to your nursing supervisor. This ensures that the proper protocol for investigating missing controlled substances can be initiated, and the client's pain management can be addressed safely. Question 35. When caring for a client with a new colostomy, the HHA notices that the stoma, the opening, appears pale and slightly bluish. What should the HHA do? A. Document the color change and continue with colostomy care. B. Gently massage the stoma to improve blood flow. C. Immediately report the observation to the nursing supervisor. D. Reapply the colostomy bag tightly to prevent leakage. Answer C. Immediately report the observation to the nursing supervisor. This question tests your ability to recognize and report critical changes in a colostomy stoma, which indicate potential complications. The keywords stoma appears pale and slightly bluish are highly significant. A healthy stoma should be moist, red, or pink, similar to the inside of your mouth. A pale, bluish, or purple color indicates a lack of blood flow, ischemia, to the stoma, which is a medical emergency requiring urgent attention from a nurse or doctor. HHAs do not massage or attempt to treat this condition. Your crucial role is to promptly report this observation to the nursing supervisor to ensure immediate medical intervention. Question 36. An HHA is teaching a client about energy conservation techniques due to chronic fatigue. Which of the following tips would be most effective? A. Encourage completing all tasks in one burst of energy early in the day. B. Advise the client to alternate periods of activity with periods of rest. C. Suggest relying entirely on others for daily tasks to avoid fatigue. D. Recommend vigorous exercise daily to build stamina. Answer B. Advise the client to alternate periods of activity with periods of rest. This question focuses on practical strategies for energy conservation, a vital aspect of care for clients experiencing chronic fatigue. The keyword most effective points to a sustainable and balanced approach. Alternating periods of activity with periods of rest, also known as pacing, allows the client to perform necessary tasks without completely depleting their energy reserves. This helps prevent overwhelming fatigue and promotes a sense of control. For example, a client could prepare part of a meal, then rest, then finish the meal preparation. Completing all tasks at once, A, or vigorous exercise, D, would likely worsen fatigue, and relying entirely on others, C, diminishes independence. Question 37. A client with a feeding tube requires mouth care. What is the most important consideration for the HHA during this procedure? A. Use a commercial mouthwash to ensure fresh breath. B. Provide thorough mouth care, especially to moisten the mouth, as the client is not eating orally. C. Elevate the head of the bed to a semi-Fowler's position before starting. D. Check the feeding tube placement before performing mouth care. Answer: B. Provide thorough mouth care, especially to moisten the mouth, as the client is not eating orally. This question highlights a specific aspect of care for clients with feeding tubes. The keyword client with a feeding tube and the context of mouth care are important. Clients who are not eating orally do not produce as much saliva, making their mouths very dry and prone to bacterial growth, which can lead to infection or discomfort. Therefore, providing thorough mouth care to keep the mouth moist and clean is crucial for oral health and comfort. While elevating the head of the bed, C, is important for preventing aspiration if the tube is being fed, the most important consideration for mouth care itself is maintaining oral hygiene and moisture. Question 38. The HHA is assisting a client with bed mobility. The client is heavy and difficult to move alone. What should the HHA do first to ensure safety? A. Attempt to move the client slowly and carefully by themselves. B. Call for assistance from another HHA or family member. C. Use a draw sheet or slide board if available, and if trained. D. Ask the client to try and move themselves as much as possible. Answer: B. Call for assistance from another HHA or family member. This question emphasizes patient and caregiver safety during transfers, particularly with a heavy client. The keywords heavy and difficult to move alone immediately signal a need for assistance to prevent injury to both the client and the HHA. Attempting to move a client alone when they are too heavy poses a significant risk of musculoskeletal injury to the HHA and potential harm to the client. The first step is always to ensure you have adequate help or the proper equipment. Calling for assistance is the most direct way to ensure the safety of everyone involved before any movement occurs. Question 39. An HHA notices that a client, who usually enjoys conversation, has become withdrawn, makes little eye contact, and often sighs deeply. When asked if they are okay, they respond, "I'm fine," but their demeanor suggests otherwise. What should the HHA do? A. Respect the client's verbal response and continue with the care routine. B. Report the changes in mood and behavior to the nursing supervisor, noting the discrepancy between verbal and nonverbal cues. C. Try to cheer the client up by telling jokes or stories. D. Ask the client's family if they know why the client is acting this way. Answer: B. Report the changes in mood and behavior to the nursing supervisor, noting the discrepancy between verbal and nonverbal cues. This question tests your observation skills and ability to recognize subtle but significant changes in a client's emotional state. The keywords withdrawn, little eye contact, sighs deeply, and demeanor suggests otherwise are crucial nonverbal cues indicating distress, even when the client verbally denies it. HHAs are trained to observe both verbal and nonverbal communication. It's vital to report these behavioral changes to the nursing supervisor, as they could indicate depression, anxiety, or another underlying issue requiring professional assessment. Your accurate reporting ensures the client receives appropriate emotional support or medical evaluation. Question 40. A client with dysphagia, difficulty swallowing, is scheduled for a meal. The HHA notices the client's thickened liquids are not prepared according to the specific consistency ordered in the care plan. What is the most appropriate action? A. Serve the liquids as they are, as some thickness is better than none. B. Thicken the liquids further using a spoon of cornstarch. C. Inform the nursing supervisor and request clarification or proper preparation instructions before serving. D. Encourage the client to drink slowly to prevent choking, despite the incorrect consistency. Answer: C. Inform the nursing supervisor and request clarification or proper preparation instructions before serving. This question addresses client safety, particularly for those with dysphagia, where precise liquid consistency is vital to prevent aspiration. The keywords dysphagia, thickened liquids, and not prepared according to the specific consistency ordered highlight a serious potential risk. Serving liquids of the wrong consistency can lead to choking or aspiration. HHAs should never alter care plan instructions or attempt to correct medical preparations independently. The most appropriate action is to immediately notify the nursing supervisor for clarification or to ensure the liquids are correctly prepared, preventing a potentially life-threatening event. Question 41. An HHA is assisting a client with personal hygiene. The client repeatedly tries to touch the HHA inappropriately and makes suggestive comments. What is the HHA's most appropriate response? A. Ignore the behavior, as the client may have a cognitive impairment. B. Politely but firmly tell the client the behavior is inappropriate and state you will stop care if it continues, then report to the supervisor. C. Immediately leave the client's home and call the agency. D. Distract the client by changing the subject. Answer: B. Politely but firmly tell the client the behavior is inappropriate and state you will stop care if it continues, then report to the supervisor. This question addresses professional boundaries and how to respond to inappropriate client behavior, a critical safety and ethical concern for HHAs. The keywords tries to touch the HHA inappropriately and suggestive comments indicate harassment. Your safety and comfort are paramount. The most appropriate response is to address the behavior directly, politely, and firmly, setting a clear boundary. It is also important to state the consequence of continued behavior, stopping care, and then immediately report the incident to your supervisor. This ensures your safety, maintains professional standards, and allows the agency to address the situation properly, potentially adjusting the care plan or assigning a different HHA. Question 42. A client's care plan indicates they should be repositioned every 2 hours to prevent skin breakdown. The HHA checks the client after 1.5 hours and finds they are lying in the exact same position. What should the HHA do? A. Wait another 30 minutes, then reposition the client. B. Reposition the client immediately and adjust the schedule if needed, documenting the action. C. Document that the client was found in the same position and notify the supervisor at the end of the shift. D. Gently remind the client that they need to move more frequently. Answer: B. Reposition the client immediately and adjust the schedule if needed, documenting the action. This question assesses your proactive approach to preventative care, specifically regarding repositioning to prevent pressure injuries. The keyword repositioned every 2 hours is a strict directive in the care plan, meaning the client should not be in the same position for longer than this interval. Finding the client in the same position after 1.5 hours means they are at risk of exceeding the 2-hour limit if not moved immediately. The correct action is to reposition them right away to prevent skin breakdown, document this intervention, and then adjust the next repositioning time accordingly. Waiting or just documenting delays crucial preventative care. Question 43. The HHA observes that a client's urine output has significantly decreased over the past 24 hours, and the client seems unusually lethargic. What is the most appropriate action? A. Encourage the client to drink a large amount of fluid quickly. B. Document the changes and report them to the nursing supervisor immediately. C. Take the client's temperature to check for a fever. D. Assume the client is just sleeping more due to age. Answer: B. Document the changes and report them to the nursing supervisor immediately. This question tests your ability to recognize and report critical signs of potential dehydration or kidney issues. The keywords significantly decreased urine output and unusually lethargic are red flags indicating a serious change in the client's condition that requires immediate medical attention. As an HHA, you do not diagnose the problem or try to force fluids, which could be harmful depending on the underlying cause. Your essential role is to accurately document these important observations and promptly communicate them to the nursing supervisor, who can then initiate the necessary medical assessment and intervention. Question 44. A client has a "No Visitors" sign posted on their door, which the HHA helped them put up. Later, the client's adult child arrives and insists on entering. What is the HHA's most appropriate response? A. Allow the child to enter, as they are family. B. State that the client has a "No Visitors" sign, and then politely ask the child to wait outside while you check with the client. C. Tell the child that they need to get permission from the nursing supervisor. D. Explain that you cannot allow anyone to enter the home. Answer: B. State that the client has a "No Visitors" sign, and then politely ask the child to wait outside while you check with the client. This question addresses client rights, autonomy, and how to handle visitors, especially when a client has expressed a clear boundary. The keywords "No Visitors" sign and "client's adult child insists on entering" create a conflict between the client's stated wish and the visitor's demand. Your role is to uphold the client's wishes, but also to maintain professionalism. The most appropriate action is to respectfully inform the visitor of the client's request and then, while the visitor waits, discreetly check with the client to confirm if they wish to see the specific visitor at this time. This respects the client's autonomy and avoids making assumptions or unnecessary conflict. Question 45. An HHA is providing care for a client with an indwelling urinary catheter. What is the most important infection control measure for the HHA to perform? A. Clean the catheter insertion site with alcohol every day. B. Keep the drainage bag above the level of the bladder. C. Ensure the drainage bag is emptied when it is full. D. Keep the drainage bag below the level of the bladder and ensure tubing is free of kinks. Answer: D. Keep the drainage bag below the level of the bladder and ensure tubing is free of kinks. This question focuses on critical infection control measures for clients with indwelling urinary catheters. The keyword "most important infection control measure" highlights the primary way to prevent urinary tract infections, UTIs, associated with catheters. Keeping the drainage bag below the level of the bladder prevents urine from flowing back into the bladder, reflux, which can carry bacteria and cause infection. Ensuring the tubing is free of kinks allows for continuous, unobstructed drainage, also reducing the risk of reflux and bacterial growth. Cleaning the site with alcohol, A, is incorrect. Gentle soap and water are usually used, and the bag should be emptied before it's completely full, C, to prevent it from becoming too heavy or touching the floor. Question 46. A client who uses a hearing aid complains of not being able to hear well. What is the first thing the HHA should check? A. The volume setting on the hearing aid. B. If the hearing aid battery is dead or inserted incorrectly. C. If the hearing aid is clean and free of wax buildup. D. If the client has excessive earwax in their ear canal. Answer, B, if the hearing aid battery is dead or inserted incorrectly. This question tests your troubleshooting skills for common issues with assistive devices, specifically hearing aids. The keyword "first thing the HHA should check" implies starting with the most common and easily fixable problem. A dead or incorrectly inserted battery is frequently the reason a hearing aid stops working. After checking the battery, you would then proceed to check if the hearing aid is clean, C, and if there's any obvious earwax in the ear, D, but the power source is the most fundamental and first check. Question 47. An HHA is assisting a client with limited mobility to use a commode. After the client is seated, what is the most important safety measure? A. Leave the client alone for privacy. B. Ensure the call light is within reach and stay close by if the client needs supervision. C. Close the bathroom door and wait outside. D. Remind the client to call when they are finished. Answer, B. Ensure the call light is within reach and stay close by if the client needs supervision. This question addresses client safety during commode use, especially for clients with limited mobility. The keyword "most important safety measure" emphasizes fall prevention and ensuring assistance is readily available. Even if a client is seated on a commode, they are still at risk of falling, especially when attempting to stand or if they feel weak. Leaving them completely alone, A, or waiting outside, C, increases fall risk. The HHA should ensure the call light is within easy reach and, depending on the client's needs and care plan, remain nearby or within earshot to provide immediate assistance if needed, respecting their privacy as much as possible while maintaining safety. Question 48. An HHA observes a client regularly receiving calls from a company asking for their bank account details, and the client seems confused but willing to give information. What is the most appropriate action for the HHA? A. Tell the client to hang up the phone and ignore future calls. B. Document the observation and immediately report it to the nursing supervisor. C. Ask the company caller for their details to verify their legitimacy. D. Discuss with the client how to manage their finances more securely. Answer, B. Document the observation and immediately report it to the nursing supervisor. This question describes a potential elder abuse situation, specifically financial exploitation, which requires immediate and serious attention. The keywords "regularly receiving calls from a company asking for their bank account details" and "client seems confused but willing to give information" are strong indicators of a scam or predatory behavior. As an HHA, you are a mandated reporter for suspected abuse or exploitation. Your most appropriate and ethical action is to document these observations and immediately report them to your nursing supervisor, who can then initiate the proper channels for investigation and protection of the client. It is not your role to intervene directly with the scammer or provide financial advice. Question 49. A client receiving oxygen via nasal cannula frequently removes the cannula, stating it is annoying. What is the most appropriate way for the HHA to address this? A. Gently remind the client about the importance of oxygen for their health and try to distract them. B. Secure the cannula more tightly with tape to prevent removal. C. Document the non-compliance and inform the supervisor at the end of the shift. D. Tell the client they cannot remove the oxygen and reapply it each time. Answer, A. Gently remind the client about the importance of oxygen for their health and try to distract them. This question addresses common client non-compliance with treatment, particularly when it causes discomfort. The keywords "frequently removes the cannula" and "annoying" indicate the client's discomfort. Taping the cannula, B, can cause skin irritation and is generally not an appropriate solution. Simply reapplying it, D, without addressing the underlying issue won't solve the problem. The most appropriate initial approach is to gently educate the client on why the oxygen is important for their well-being, acknowledging their discomfort, and then use distraction or comfort measures to help them tolerate it. It's also important to document and report this ongoing issue to the supervisor, as the care plan might need adjustment or a different oxygen delivery method could be considered. Question 50. What is the primary purpose of the Home Health Aide Care Plan? A. To serve as a legal document for billing purposes only. B. To provide a standardized guide for the HHA to follow, outlining specific tasks and client needs. C. To inform the client's family about the HHA's schedule. D. To allow the HHA to decide which tasks are most important each day. Answer: B. To provide a standardized guide for the HHA to follow, outlining specific tasks and client needs. This question focuses on the fundamental purpose of the HHA care plan. The keyword primary purpose directs you to the main reason this document exists. The care plan is a critical communication tool developed by the supervising nurse or therapist, specifically detailing the client's needs, goals, and the specific tasks the HHA is authorized and expected to perform. It ensures consistent, personalized, and safe care, acting as a roadmap for the HHA's daily responsibilities. It is not just for billing, family communication, or HHA discretion. Following the care plan accurately is essential for providing effective and safe home care.